Each year, approximately 17,000 people in the United States are diagnosed with primary brain tumors, and over 150,000 people are diagnosed with metastatic brain tumors. Surgery followed by radiation is known to be the most effective treatment option for malignant brain tumors. There are several ways to deliver radiation. One of these is the GliaSite radiation therapy system.
The main treatments for brain tumors are surgery, radiation, and chemotherapy. Radiation is the single treatment that's of the most benefit, and surgery comes second. Well, the GliaSite combines the benefits of both. You do the surgery to take out a tumor and getting that benefit, and then you're able to safely deliver additional radiation beyond what could be delivered with conventional radiation.
GliaSite radiation therapy is completed in several steps. Here's how it works. After surgery to remove the tumor, the uninflated GliaSite RTS balloon catheter is placed inside the space left by the removal of the malignant brain tumor. The other end of the catheter extends outside of the skull and is concealed underneath the skin at the top of the head. Once the patient has recovered from surgery, a solution containing Iotrex, a proprietary liquid radiation source, is injected into the catheter and fills the balloon. Iotrex delivers radiation to the edges of the tumor cavity, targeting places where cancer may remain. The Iotrex and saline mixture stays in the balloon catheter for approximately 3 to 7 days until the prescribed dose of radiation is delivered. The Iotrex and saline are then withdrawn, and the GliaSite RTS catheter is removed during a brief surgical procedure.
The thing that limits the dose of radiation that we can give now is the toxicity to normal tissue. The GliaSite has the advantage that it's delivering most of its dose to an area where there are a lot of tumor cells, and that the dose doesn't spread out to the normal tissue. So the normal brain is going to receive very little dose of radiation, and that's a tremendous advantage in comparison to delivering the radiation from the outside in. This is a GliaSite catheter, and the most important part is the balloon, which goes into the resection cavity. So after we take a tumor out, we place the balloon. There are 3 different sizes, and we place the right size balloon that just fills the cavity so that the edge of the balloon, when it's inflated, is right up against the brain, and that's the brain that has the highest concentration of tumor cells. The radiation dose then falls off from the balloon quite quickly. So by the time we're an inch away from the balloon, there's not much radiation dose. But again, that's where 90% of the tumor recurrences are, is within that 1 inch. The GliaSite has the advantage of giving us a minimum risk of injuring normal tissue while maximizing the dose to the abnormal tissue.
GliaSite is appropriate for treatment of malignant brain tumors that can be surgically removed. Patients that have been treated with the GliaSite include those with newly diagnosed primary malignant brain tumors, recurrent primary malignant brain tumors, and metastatic brain tumors.
We've always been able to deliver radiation internally, but involved rods coming out of people's heads, and it was really a lot to go through. The GliaSite we can put in, it's entirely underneath the skin, and the patients tolerate it very well. It's very respectful of the quality of life.
The procedure involves 3 steps. First, the catheter is implanted at the time of surgery. It is filled with radiation after the patient recovers from surgery, and later the radiation and catheter are removed. Let's take a look at each step in detail. During surgery for removal of the tumor, the GliaSite balloon catheter is inserted into the cavity created by the surgery.
Patients usually wake up after removal of the tumor within a few minutes after they stop the anesthetic agent, and post-operatively, most of the patients who have lesions removed do remarkably well, up and about, oftentimes the day of the procedure, usually discharged after a couple days. Now that can be different in patients that have lesions that are near what we call eloquent areas of brain that are controlling vital functions like language or movement. But by and large, most patients are out of the hospital in a couple of days.
Following surgery, a syringe is used to inflate the balloon-tipped end of the catheter with Iotrex, a proprietary radioactive liquid. The Iotrex remains in the balloon for a period of 3 to 7 days, irradiating the area immediately surrounding the cavity where tumors are most likely to recur, and minimizing the damage to healthy brain tissue.
They are usually readmitted after about 4 days for about a 4 to 5 day stay when we inject the radiation.
And basically it was a 30-minute procedure, and they used an infusion set to prick the GliaSite and to put the radiation in. And it was no pain whatsoever. It was just like a needle prick. And after that, I sat for 4 days in the hospital. I read books, watched TV, did everything normal, got up every morning, took a shower, and the only thing was that I could not leave that room. And so I had to depend on the nurses or my family members and friends to get ice and that kind of thing. But other than that, it was a very normal day.
After the prescribed amount of radiation is delivered, the Iotrex is removed from the GliaSite balloon, and the device is taken out in a simple surgical procedure.
Our experience has been that the catheter removal is a very simple thing. Most patients tolerate it very well.
The GliaSite radiation therapy system is one of only a handful of treatment options that have become available to brain tumor patients in the last 10 years. Since its availability in 2001, the GliaSite RTS is offered at more than 100 hospitals in the United States and Europe. The GliaSite and its patients have been featured in the news nationwide. Here's Tracy's story from Charlotte, North Carolina.
A local woman is celebrating a wonderful milestone, 1 year cancer-free, after a scare that had local doctors trying something they'd never done before. In May 2001, Tracy Frederick had cancerous brain tumor, but just 3 weeks later, the cancer came back.
That was the most scared I had ever been in my life.
We knew we had to move quickly because Tracy's tumor was not giving us much time.
Radiation oncologist Bob Frazier and neurosurgeon Anthony Asher were looking for options.
And we knew that surgery alone wasn't going to do it. She had already failed that, so something else had to be done if she had a chance.
That something else was something entirely new. GliaSite radiation therapy, never used before in Charlotte and FDA approved just months before Tracy needed it. 1 year later, no sign of cancer. Tracy's now back at work and looks to the future with hope.
I feel very lucky. I feel like I've got a new chance at life, so I'm very active and I try to take one day at a time and make the best of it.
Now, this is amazing timing, especially because just weeks before Tracy's first surgery, the people who make GliaSite, that product, they're showing it to the doctors, wondering if they thought they'd have any use for it in the future. Of course, it turned out that they did. She's doing very well. It's hard to say what the future will bring, but she gives all the credit to her doctors and to the hospital, who also, they had to approve this for use very, very quickly, and everybody really came together.
Excellent.
Wow, yeah. Great story.
All right, great. Thanks, Stace.
At the time of this recording, Tracy had just completed her 2-year follow-up from time of GliaSite treatment. Her MRI scan showed no recurrence of tumor. She was stable, working, and doing well. Tracy's results have been promising. However, results may vary from patient to patient.
I don't look at life like I did before. I took life for granted. So every morning you get up and you say, "Thank you, Lord, for giving me another day." And you go about your day in the same way, but you appreciate your family, you appreciate your friends, you just appreciate life.
If you have questions about the procedure or the treatment's appropriateness for your specific condition, please ask your physician.